Once the child's mind is ready about to accepting this phase of their life, they can easily get in and handle this phase and these kind of pains easily, because they already know.
Obviously, patients or people who are in good mental health, they listen to others.
Early diagnosis leads to early management, and early management leads to better outcomes.
Women's health isn't just physical, it's emotional, mental, and social. Experts discuss why a holistic approach is the key to better care, the importance of early diagnosis and intervention for dysmenorrhea,
which is totally based on parents. First, we need to sensitize the parents. Then they have to make their girls' mind that coming years they will face some kind of issues regarding this. These are preventions and we can say early interventions. Once the child's mind is ready about to accepting this phase of their life, they can easily get in and handle this phase and these kind of pains easily, because they already know that all girls have having same issue, so they can handle it. And I think if the issue is severe, then parents should be very close to their girls and they have to go to the gynecologist.
Obviously, patients or people who are in good mental health, they listen to others. They opt for investigations, diagnosis early on, and they find it easy to get treated, as opposed to somebody whose mental health is not perfect and treatment will be or can be delayed because of poor mental health.
Early diagnosis leads to early management, and early management leads to better outcomes. So it is always good to address the things which are bothering a girl and needs to be addressed early.
Integrating mental health and physical health in treatment plans.
We always, being a child psychologist, first when I take the child for the intake session and getting the all kind of information regarding the specific problem, I always ask about the medical situation of the child, because sometimes multiple psychological issues triggered by the medical issues. So medical, physical or psychological, both are interconnected. Like I said before, that healthy mind have a healthy body, and healthy body has a healthy mind. So it's vice versa.
Yeah, so when we are interviewing patients, explaining treatment to patients, I'm a medical oncologist, so patients come to me after their diagnosis of cancer. So when I discuss treatment with them, we take into account not just the physical health of the patient, but also the mental health, because this is a human being. This is so mental health is so important. If the mental health is poor, they will not be able to tolerate the treatment. Good mental health leads to good physical health. So if the mental health is poor, they may not either start treatment, or they may abandon treatment in the middle of it. So I agree. I mean, when you ask, this is a very good question. Mental health is as important as physical health.
There are different intensities of dysmenorrhea. Some girls, they only feel discomfort or mild pain, but some experience severe pain. So the mental health also, or the mental issues, they are related to the physical symptoms. Girls with only the discomfort or mild pain, they can easily cope up with it, but those having the severe pain, their quality of life is severely affected, including their mental health also.
Policy changes and healthcare reforms needed in Pakistan.
Again, I will suggest here campaigns. We have to start campaigns in remote areas, and I want that government should, the stakeholders, those kind of people who have power, who can change. Only caregivers, only health practitioners can't do anything, because I'm suffering a lot. I am doing multiple things, but somehow, somewhere, multiple things can stop us. So it's important to aware we have to facilitate those living persons which are so far living in the rural urban area or different kind of modern areas. So we need help, and we have to join hands with management, with unity, any kind of community who can help us.
They're needed all over the world, more so in developing countries or underdeveloped countries like Pakistan. We do run a lot of awareness campaigns. Many people do, many groups do, like yourself. So awareness campaigns are very important. Education of the masses is important. Not everything has to be done by the government, but of course good policies, laws should be made. Medical education should do its bit. Doctors, nurses should do their own bit, and we have a lot of awareness programs on television which are not enough actually. We have awareness programs which are in print media also, but we need to talk about it more. There are stigmas associated with some of these cancers. People don't want to talk about them, and we should be talking about them, just like we should be talking about prevention of cancer, tobacco-related products. This is what we should be focusing on, rather than focusing on treatment and diagnosis itself.
That is something which I guess you ask anybody, and not a health professional, anybody, and they would say yes. So my answer is also yes. It is very important to do the health reforms, especially the health of women, because they are the ones who are bearing the torch to reproduction and increasing the population out there. So I'm not saying that the men should be ignored, but the women health is a priority, I guess.
It's time for a shift in women's healthcare. From better policies to holistic treatments, let's push for real change. Your voice matters. Be part of the movement.